For the next issues which we'll be discussing is the bone spurs. Okay, bone spurs. So bone spurs just have to do with some kind of like growth. Do you understand? It's bony growth. Okay, out of the original normal bone, you are having some 1 or 2 growths that are not supposed to be there. Do you understand? Mostly occurs on the heel, right? That's what they call it, the heel spurs. So bone spurs, you should know that they are also known as osteophytes. They are bony projections that they develop along the edge of bones. Okay, so often where bones meet at joints, okay, you mostly see them developing here. So they are your body's way of trying to repair itself, but it can cause problems. Do you understand? So most of the times where this thing is causing problem is if a nerve is passing nearby here, this growth can impinge it. You understand? Causing all those numbness issues. So what causes the bone spurs is osteoarthritis. So the most common cause is the cartilages is wearing down. Okay, then the body is trying to compensate by growing extra bones. Okay, so if it's your body's mechanism of trying to handle issues. So it could be tendonitis, could be ligament inflammation, could be injuries or trauma, could be genetics where the issue just runs in the family, could be overuse. So you have overused that joint. You understand? So you're having issues coming in. So common locations where you can actually find bone spurs, we have the spine, followed by the heel, followed by the shoulder, followed by the knee, then the fingers. Okay, so this is even on the toe. Do you understand? So it could actually occur on the toe too. All right. So symptoms, issues that such a patient with bone spurs will be facing include pain near the affected joint, stiffness or reduced range of motion, numbness or tingling. There's a visible lump, that's like, you understand, under the skin. The bone growth can be pushing up the skin, So weakness in the nearby muscles. Some bone spurs cause no symptoms. Do you understand? So some of them you can just discover them incidentally on imaging. So treatment is all those physical therapies, non-steroidal anti-inflammatory drugs, orthotics, corticosteroid injections. Then surgically, where you try to remove the spurs, the lifestyle where you manage weight, wear the proper footwear. So if you know that I have issues like this, they can make customized footwears for you, just to that are actually joint friendly. Okay, that won't actually interfere with the bone stuff. So that's for what we have for osteophytes. Okay, so that's it.